Another delay for Obamacare, just the administration isn't calling it a delay, it's calling it giving consumers extra flexibility. In a conference call with reporters this afternoon, White House officials refused to talk about a new deadline. They just admitted they're blowing through the old one. That deadline is supposed to be next Monday, March 31st. Let's talk to Dr. Sreedhar Potarazu, CEO of Vital Springs Technology, for more details. What do you make of, okay, I'm just going to speak English here, the delay?
Call it what you want, Jerry. We've been to this rodeo before, and the magic number, as you said earlier, is 37. This is the 37th delay. And the remarkable thing today, if you look at the Pew report, is that 37%, if not more, of uninsured people didn't even know about the deadline. What does that tell you? That they're constantly trying to move the yardstick in terms of trying to shepherd as many people as they possibly can, but yet every time they move that goalpost, everybody gets concerned because things are not working. And what does this delay actually mean? What it means is that there are likely a lot more serious problems behind the scenes.
Right.
And getting the enrollees actually processed through the system to make sure they end up in the right insurance plans, and the fact that their payments are actually being processed. And I can guarantee you,
it's not happening. The back end still isn't finished. And yet,
that's exactly right.
And yet, when you talk to the federal government, when you talk to PR for the White House, when you talk to Health and Human Services, they all said the same thing for a long time. The 31st is the deadline. Listen to this.
March 31st is the deadline for enrollment. You've heard us make that clear.
There is no delay beyond March 31st.
Can you rule out the idea that the president doesn't delay the individual mandate? Yes, I can. You can. That will not happen. That will not happen.
That will not happen. The 31st is the deadline, my friends. Now we have, as you said, 37 delays or tweaks to the law. 37. What does that tell you about how well this is working and what it means, frankly, for not just people who would like to enroll, but also insurers?
What that tells you is the initial mechanics of the Affordable Care Act, now on its 4th birthday, are not the law that was passed 4 years ago, and that with all of these changes, the intention of getting all of these uninsured people within the ranks into the system has not worked. That a lot of young people who need to sign up in order to pay for the Affordable Care Act has not worked, despite the president's best effort to try and market that, and that ultimately people are not going to be able to keep the plans or the doctors that they hopefully intended to do. So for any of the critics today who talk about the fact that really people shouldn't be talking about repeal, perhaps repeal is not the right word, but what is the right word is reevaluating where the Affordable Care Act sits 4 years later after 37 changes, and what it in fact is costing the American taxpayer and solving a problem that is not fulfilling the original intent.
Not by a long shot. In fact, we have 6 million Americans who've had their plans canceled. More than the number of people who've been signed up, which stands at about 5 million, although we're not really sure because we get a different report every single day. And just to remind our viewers, if you want to take advantage of the delay, you can take it. Healthcare.gov. Go to the website, push the little blue button. You'll be able to get an extension. Dr. Potarazu, thanks for coming on. It's always good to have you on the show. Thank you so much.
Thank you, Jerry.